Good afternoon. My name's Maddie Peacock. When considering the impacts of smart technology in medicine, it is important to consider how they have impacted the United States healthcare system over the past 10 years. Over the past 10 years, the rise of consumer-based technology, such as smartphones and many other smart connected devices, have fallen under the sort of label of the Internet of Things, or IoT. This includes, but is not limited to, many different things such as computers, smartphones, smart dishwashers even, that connect to the internet and share data through this. Through this, according to Brian Chen of the New York Times, many consumer technologies such as Apple Watches and other smartwatches have become more adapted to track things such as heart rate that connect to medicine. As this awareness of medicine increases, smart medically based technologies have positively impacted the United States healthcare system by creating opportunities for economic expansion, improving patient care systems, and improving patient care flexibility. To begin, smart technology has had a major economical impact in the United States as it represents a major portion of the economy. Healthcare workers represent around 18 million people, or 12% of the United States population. With so many people relying on the healthcare system, not only for care for them and their families and loved ones, but also for their livelihoods, a major part of our economy is wrapped up in that, meaning that as it rises, the technologies also rise. And as the healthcare system struggles, our economy struggles as well. Technology is getting linked into more and more things in healthcare and is therefore not only making up a part of the technology system, but also the healthcare system. As seen in the image to your right, mobile-based healthcare platforms have become more and more common in being able to allow doctors to communicate with patients, according to Adam Litwin of UC Berkeley. Many corporations also plan to incorporate more and more smart technology in their healthcare systems in future years. According to a survey done in November 2018 among 1,400 individuals speaking on behalf of their biotech companies, 58% plan to spend more than $100,000 on Internet of Things solutions for healthcare within the next 5 years. This is a major portion of what they spend, anywhere from 100,000 to over 100 million. With all of this money going into these technological solutions, technology plans to grow, and with it, the healthcare system does as well. There are many people involved in the design process for these different healthcare systems, from systems engineers, computer scientists, doctors, and nurses, to the most important aspect of it, patients. All of these people are able to communicate and collaborate to provide a healthcare system that cares for all people with the most expertise that they can bring to the table. For example, computer scientists are able to figure out how the system can work in order to properly care for people most efficiently. And doctors and nurses have the healthcare expertise to figure out how to design the system so that it can help the patients the most. This was found through a study by Philip Laplante and many expert nurses and computer scientists collaborating to explain how smart healthcare systems can benefit patients overall. One example of when this has really worked is the Seattle Children's Hospital Smart Cart. As you can see in the images here, the Smart Cart is a mobile cart that goes into hospitals and uses camera technology to relay information about what's happening in the hospital room back to people who are being trained, so medical students primarily. This allows them to get more experience and hands-on training about how to care for patients without the costs and implications of them being there in person. This helps medical students to be able to be not only more comfortable with technology, but also more confident in their medical decisions, benefiting patients in the long run. Medical sensors are also a major part of how Internet of Things technology and smart tech is able to benefit patients by making more flexible care possible. Sensors collect healthcare data and then transmit it to be able to be studied and analyzed at different locations, such as a laboratory or a doctor's office. This works through many different sections of the Internet of Things working together, as we can see in the image here, and allows for patients to not necessarily be in a hospital to get the high quality care that comes with the constant monitoring. Some examples of how this might work are a sensor onesie for high-risk patients such as infants that monitors many different vital signs, especially with infants, the elderly, and people with high-risk conditions. In order to be taken care of safely and allow them to get the medical care that they need almost constant monitoring of some of their vital signs. And smart clothing and other sensor technologies allow this to be very non-intrusive for them because, as we can see in the image to the left, most sensors are able to be very small and non-intrusive into people's lives, allowing them to spend time with family and friends rather than in a hospital, while still receiving the care that they need if anything were to go wrong. The solution that I propose to continue improving our healthcare system is to encourage a creation of healthcare systems that communicate between different occupations, so doctors, nurses, computer scientists, in order to make the best possible system for patients. I also recommend that we have more people invest in the economy for technology and especially medical technology to continue growing this aspect of the economy, and continue to focus on improving flexible patient care so that patients have the opportunity to not only thrive physically as they would in a hospital with constant care, but also mentally, socially, and emotionally by being able to have the flexibility to do what they would like and to spend time with family and friends. These solutions would require a bit of work, but overall, they would improve our healthcare system by allowing more focus on the patients and how to best benefit them with the rising technology of today. For more information on any of this, please feel free to look at these references. Thank you so much. Any questions?
I do have two questions for you. First up, let's see. How did you select the strategies you used to gather information or conduct a research, and were they effective?
Well, what I started with was figuring out how much research was really out there on my topic. And I knew that I needed to do this because I had seen many people try to go about their research and decide on a topic and start researching without any idea of what was happening beforehand. So I selected a sort of way to look great broadly at my research through EBSCO and some quick Googling. And I was able to find, yes, there is information out there. One more thing that I found super helpful was broadening my search topics and finding other words that worked. For example, I started off looking for Internet of Things information. And as I went through my research, I found that a lot of medical technology uses the term smart technology rather than Internet of Things technology. And by searching for smart technology instead of the other keyword, I was able to find a lot more information on what I wanted to see.
Okay, and what advice would you have for other researchers that are considering this topic?
The advice that I would give them is to make sure that they know where their sources are coming from and that all of their information is reliable. Because medical technology is such a new field and there's always new developments, they need to know that what they're looking at has had the time to be peer reviewed and approved, and that it is not only valid, but it makes an argument that is in line with the sort of advancements of the time.